base, how do we determine the cash goal for the company?
Okay. Well, the cash collection goal is based on primarily the revenue that we report. So it's the baseline is the net revenue. So there's a timing difference. So in the scheme of things, net revenue and cash collections are pretty much the same number. Net revenue equates to how much cash we bring in as a company. And the difference between the cash goal and the net revenue we report is just a timing difference. So the revenue comes first, the cash comes later because we have to wait for our money. It has to go through a third party, and whether it's a Medicare, Medicaid, or an insurance company. We collect a very small portion of it up front, as much as we focus on the PFR initiative to get the payment up front for what the patient's responsible for. That'll never be more than 5% of our total revenue. So the rest of it, we have to wait on it and jump through all the hoops and wait for the medical documentation to come in before we can bill, and then work denials and all that kind of stuff. So the answer to your question is the cash goal is based on the net revenue that we report, which should predict how much cash is going to come in later.
Okay.
So that's where the cash goals come from. Is we report net revenue for a quarter. So we'll take we just wrapped up a quarter. December's the end of our first quarter. So our cash goal for the next quarter, which is January, February, March, will be based on what the net revenue was for this last quarter. It'll be some percentage of that.
Right.
So when a company's growing, your cash so timing is one thing, and then if you're in a growth mode like we are, our revenue's been steadily going up about 5% a year. Then there's even a bigger lag between net revenue when the cash comes in. So the net revenue goes like that, and then the cash follows later. So it'll never. So my guess, just as a rule of thumb, the next quarter's cash goal will be about 97 to 99% of the previous quarter's net revenue.
Okay.
And if we don't collect that, that means we're kind of overstating the net revenue, and the important thing about achieving the cash goal is if we don't achieve it, if we miss it by a lot, that means that the net revenue was overstated, or we were too optimistic of what that revenue was, and then it has to come down.
Okay.
But over a long period of time, they're going to equal each other. So if you hit the cash goal, or if we exceed it, like we just wrapped up a quarter where we beat it by like $1.6 million, that means it's going to net revenue is going to get a boost because it was too low. It was too low. Right. So that's why we always want to beat the cash goal, because that means that we can pump up the net revenue in the future.
Yeah.
Because we were overly pessimistic. We were unwarrantedly pessimistic about what that net revenue was, and it gets a little. I call it the tailwind effect.
Yeah, it's sold up.
Right. So if you beat cash goal, then you're going to get a tailwind effect, and it's going to help net revenue in the future. If we miss cash goal, then it's a headwind. Then it's going to hurt.
Push against that.
It's going to push net revenue down in the future. That's why it's important.
Right. Okay.
Good question.
And you might have answered some of this, and if you did, that's okay, but I'm still going to ask it just to be sure. How are the operating margin and the net revenue info determined?
So net revenue is based on two things. It's based on our volume of business, and then advanced home care is, I consider it having three main product lines: HME, home health, and pharmacy. Those are the three product lines. So they're based on the volume indicators. So in home health, it's the number of visits we do and the number of episodes we do for Medicare patients. That's the volume indicator. In HME, it's how many rental patients we have on census, and in pharmacy, it's how many pharmacy admissions that we have. Those are volume indicators, and they impact the net revenue. Then the other factor is there a headwind or a tailwind based on our cash collection? So that's the net revenue piece. So the busier we are, chances our revenue is going to go up, and if we're adding more patients, it should go up. And then the headwind, tailwind based on our cash collection. And then the operating margin is very much impacted by the net revenue and then what we're spending as a company, the operating expenses. And the direct expenses, which is the bulk of our operating expenses, is in salary and benefits. It's the people. The 1,700 employees that we have account for about 50% of the company's revenue and about 70% of the company's operating expenses. So that's the big bucket of expenses, is not just the support folks in this building and in our branches, but the folks out in the field taking care of patients.
Okay.
And so, assuming that we're all productive and we're keeping keeping a lid on this, not having too many employees, and that everyone here is as productive as they can, and the folks in the field are seeing as many patients as they can, then the expenses are more stagnant. They're less volatile than the revenue. The revenue can kind of go, depending on the headwind, tailwind, and volume, can fluctuate, but the 1,700 people are still here, and we're still paying them.
It pretty much costs the same thing.
Yeah, it's more steady. So if you look at the operating expenses and the revenue, there's less volatility. The expenses are, because they are what they are.
Okay.
So they can change over time, but in the short term, they remain pretty steady.
Right. How did you end up at Advanced Home Care?
I started with Advanced Home Care in 1990.
Okay.
When I was 29 years old. God, I think way back. So what had happened was I had a career change, a career crisis in my mid-20s. So when I got married at a young age, I quit school. I was going to UNC Chapel Hill, met my wife, and then said, hell, I don't need a degree. And so I went into the workforce and kind of struggled raising a family that way. So about my mid-20s, I had an epiphany. I got to go back and get my degree because this ain't working. Because I had different sales jobs and different things, and was struggling to keep things above. And I love numbers. I've always loved. I love statistics and things like that. So I always. I love sports and I love statistics. So I knew I was a numbers guy, but it never clicked with me that maybe you should become an accountant because they work with numbers. That might be kind of cool. It never occurred to me. So that's why So when I was thinking about, okay, I need to go back to school. What do I do? Then I said, well, I'm going to do accounting and see how that is. And so I really. So in my mid-20s, I went back to. So I kept my full-time job and I went back. I changed my full-time job and I became a bread man for a bakery. So I can work early hours and have my time free to go to school at night. So I already had half my degree done. I basically quit halfway. So I had to get the other 2 years in. So I went to UNCG at night while I worked full-time. And by the time I was 28, 29 is when it took me, I did the hard way, basically. I went back to school and it took me 5 years to get the last 2 years in. But I graduated in 1990. And by then I had quit my full-time job and was working several part-time jobs. As I got close to graduating, I realized I needed some experience. So I applied for a part-time bookkeeper job for a company that was actually related to Advanced Home Care at the time. I didn't know it. I just applied to an ad and said part-time bookkeeper, sure, I'll do that. And it turned out to be a private duty agency that was affiliated with these. At that time, the home health and the DME were separate companies, and the infusion company was just started up. And you guys may know some of the history, but there was Advanced Services, and then there was Home Care of Central Carolina. So I applied for a company that was affiliated with Home Care of Central Carolina, the home health piece.
Right.
And that was it was a 10, 15 hour, it was a startup company.
Right.
So I applied for that while I was wrapping up my accounting degree and got my foot in the door as a part-time bookkeeper while I was delivering pizzas at night. Kind of crazy, but that's what I was doing. And then so I did that for about a year, and then I got my degree in May of 1990, graduated from UNCG with a BS in accounting.
Right.
And at that point, a job came opening with Home Care of Central Carolina for a financial manager, and the same person who was in charge of the private duty agency was also in charge of Home Care of Central Carolina, so she knew me.
Right.
And so I had it in there, and so I was the only man she interviewed for the job. There was a couple women who had a lot more experience. Basically, I think I got hired because I was the cheapest. She knew me, and I wanted in very badly. And so
she knew what she could pay you to do.
Yeah, so she saved a couple $1,000 a year hiring me.
Right.
Well, but she knew me and trusted me, and I think
Right.
the interview went well and stuff. So that's how I got my foot in the door. I started as the financial manager for Home Care when it was a separate company from a DME company, and then it was just things kind of fell into place. It was the right place, the right time. So the companies merged in '93, and that's when I met Joel Mills for the first time. He was in charge of the DME company. I was working health agency, there was another person in my role working for the DME company at the time, a fellow named Dwayne Breeden. And so when the companies came together, we were kind of like, okay, are they going to keep both of us, or
Right.
we weren't sure what they were going to do. But he had a lot. The good news for me was that Dwayne had a lot of was a versatile guy. He was also I was stuck in the numbers. It was either hire me to be the lead
guy.
financial guy or out I go, because Dwayne had other skills. He was had IT. He wound up being Alan's predecessor.
Okay.
Alan's predecessor. He wound up being the CIO for a period of time. So he was able to, so he had more experience in the DME I had in the home health, and I put the financial piece together, and then he kind of gravitated toward the IT side as the finance side for the two companies kind of came together.
Yeah.
And then we just wound up being best of friends and working well together and that kind of thing. So that's how I wound up at Advanced Home Care in my late 20s, early 30s. And then as the company grew, and I passed the CPA exam in 1992, so I never went back to get my master's or anything. A lot of my peers here on the senior leadership team have a master's degree. I went the CPA route
Right.
and passed that in 92.